The muscular armor, mechanism of defense against the intruder, something unknown that tries to invade the consciousness 24/7, especially at night. Anyway, here we have some explanation about a very important point that medicine usually tries not to consider, at least in a good manner, because they are neurotic or psychopaths. So this is a kind of blind dot. They cannot perceive or notice that some abstract issues have somehow to be considered. So what we can observe, the sequence of symptoms. The jaw was clamped tight. The way the patient spoke through her teeth, as if hissing. The facial muscles with strong spasm to any attempt to pull down the jaw. Only reactions against something supernatural. What else? You have the problem with the neck, especially the supraclavicular region was extraordinarily rigid. The patient held her head somewhat, putting and tilted forward, as if she were afraid something terrible would happen to her neck if she moved her head. Something terrible, just like fear or dreams. Something relating to her vertebra. She thought it was going to collapse or be collapsed. So the patient had been in spine as a consequence, wearing a collar brace for some time, fracture cervical spine, consequence to rapid extreme movement was a possibility. So this is the main, the most important point to be considered, as later became clear. The patient made a good use of this fact as a neurotic defense, as I said in the beginning. Her fear of moving her neck existed long before, previously, before the tumor, before the symptoms, the collapse of the vertebra. Indeed, her manner of holding her head and neck was only part of the general biophysical attitude, which we had to understand, not as the result, but as the biopathic cause of her cancer. Here we have the explanation, the real cause of the especially in this case, the cause of the cancer. So something relating to emotional issues determine, or this point determines the cause of the cancer. So fear, okay, fear of something, fear previously, okay, not feeling fear of the tumor, the disease itself, but feeling fear of emotional issues, as we can see here. Not the birds, not the representation of the fear. Okay? The fear lies within, inside the person. So that's the point. So that's we have the target. We have to aim at this point. Focus on this very very important aspect before